I worked for a cosmetic dentist that would drop 10K every single month on paid ads without blinking an eye. He had no social media presence. He had no email marketing strategy. We didn't even get no Google reviews. We had like hardly no Google reviews. Um, the website was outdated because this was like 2015, 2016-ish, around that time. But we were very busy. We were booked and busy. I was a new patient coordinator. The marketing person, her name was Susan. We worked very closely together, and our offices were like literally right next to each other. So I would hear everything marketing related. And all I know is we were busy, phone was ringing off the hook, and he was investing 10K with no problem on paid advertisement. And yes, in 2015, 2016-ish, that was an effective strategy. But the reason why I will never recommend a strategy like that today for medical practices or dental practices is simply because human behavior and like buyers' behavior and human psychology has shifted tremendously. And now patients are doing their homework. And yes, they may see your ad run across their feed or whatever platform they're on. But next, they're going to your Google reviews. Then they're going to your website, specifically your About Us page, because that is the most highly visited website on a practice's page. They're going to your social media account, and they're basically stalking you because they're doing homework. And if the trust factor does not check off, guess what? They're not booking an appointment. So some would argue and say, oh, the economy sucks. Patients are no longer investing money in cosmetic and aesthetic treatments, and that is a bunch of bullshit. Yes, they still are out there, and yes, they are still investing. However, the way that they invest has shifted tremendously. They are doing homework. They are doing intense homework. They're doing research. For one, because there are so many fraudulent providers. I mean, every time you get on the internet, there's some fraudulent provider injecting some sort of substance or just doing something. These veneer techs, it's a bunch of crap going on out there. So, with that being said, people are just curious and they're doing their homework before they decide to invest, right? Another reason is because patients just want to know more about their treating providers because they're no longer just investing in anybody that can give them a nice porcelain veneers or give them 15 units of Botox. They want to know more about their providers. They